marabo. What happened?
We're done with this.
What? So many people are saying, si ano, artista ka ba? O singer ka ba? Lahat. Artista, singer. Si Pinky Marquez. Okay? So, I just want to sing a short line like, somewhere over the rainbow, way up high, there's a land that I heard of once in a lullaby. Yan. I sing Broadway songs, classical songs, pero yan lang, dapat magbayad kayo ng ticket kung manood ng show. Hi everyone, I'm Pinky Marquez Cancho. I was here 7 years ago, but because so many things happened, I didn't come back. And our dear, good Dr. Contessa Salvador was going in and out of the country, learning new procedures on how to make you feel good, how to beautify, especially now, people my age, you know. So many things have happened. Of course, we've grown older through the years, and I want my face and my body to feel good, and I want to feel happy about myself. Because I'm still in the showbiz industry. I do a lot of movies, TV shows. I still I do live shows. I sing in 2 bands, and I have concerts left and right. So I have to improve my face, yes? And lines are coming out, and the frown is coming out there. So she is so good and the best because she does it in a very subtle way so that you still maintain who you are and not look like a different person. She will do something so good, and I'm excited for today, to make you feel youthful and make you look youthful. Lalo na pag I come out a lot on television and also live shows and use a lot of makeup, you know, the wear and tear of your face, when you put on makeup and remove the makeup. Of course, everything else has to follow, like good diet and sleep and all that stuff. But number one, of course, is what she can do for you, Dr. Contessa Salvador. So you come here. I drove all the way here. It's not very far. It's only in Angeles, in this mall. So CSA Medical Aesthetics. It's on Google or on Waze. So visit her. She's the best. She will take care of all your needs for your face and your body and your well-being. We're excited. Let's start. Don't forget to subscribe and like the button below. Okay? Subscribe and like and follow Dr. Contessa Salvador at CSA Medical Aesthetics.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a returning guest. Let's all welcome Ma'am Pinky Marquez.
Hello, Doc.
Hello.
Good to see you again.
Yes.
Ever looking pretty and young.
Right.
A walking example of what she does to everybody. Natural look. Yes, I'm back. Sorry because of pandemic,
Yeah.
and you've been traveling and
like
teaching other people and getting all
my fault.
certification,
Yeah.
and winning awards left and right. So here I'm
Glory to
waiting. So now I have lines na. Kaya
She still looks so young, okay? And you mentioned you're like in early 60s? Yan.
Yes, early 60s, and I still perform, Doc, because I need that fresh look pa rin,
Right.
diba? And that uplifting
Yeah.
feel.
But you're so beautiful in your
Naku,
age.
thank you,
Yeah.
thank you.
What's
to all
the
those
secret?
my age,
Yeah.
no, I think it's just genes also.
Genes,
But with
exactly.
the help of a physician like Dr. Contessa, you can still maintain your youthfulness,
Yep.
diba?
Right.
And feel good about your age. So she makes you look the same, but youthful and young for your age. Naturally.
Beauty.
Naturally.
From inside to outside. Yeah. But Ma'am Pinky is also
Yes.
busy. A
We
lot of
are.
rehearsals.
And
shows at night, right?
Yes, yes.
Also, you travel abroad. You have
Yes.
some shows abroad.
Yes.
Yeah. So
So we
somehow,
need this.
over time, when we look at our face in front of the mirror, we see some lines, wrinkles.
A lot of wrinkles and lines because we always laugh. We're happy
Right.
people. And I love the sun.
Yeah.
Beach. So ang beach, the sun.
Right.
Ba, ano?
The UV rays break
Yeah.
down collagen in our skin,
Yes.
leading to formation of lines and wrinkles and some of the sunspots.
Sun.
Ayaw ko sabihin age spots eh. Sunspots na
Yes,
lang, okay?
yes.
And of course, with your kind of job, okay, you are in like stage acting.
Yes.
And then you have a lot of facial expressions. You use
Exactly.
more of your facial muscles. And what's happening is the muscles contracting. It's pulling the skin inward. Yan. And madalas yun.
Yes.
So what's happening on the skin layer, there's tension on the collagen fibers
Yes.
to a point that the collagen break down or gets degraded. And plus the decrease in the collagen formation from our skin because of
Yeah.
the, as time passes by, our cells kind of, gradually they are like decreasing their function.
Which is natural.
Natural, it happens.
Some people don't touch their face at all. But
Yes.
because I am in this business,
Right.
you need that. And those of you who are watching, I'm sure, you may not be in the same business, but they attend all these parties, they meet
Right.
their amigas.
Yeah.
You want to look fresh and good and not
Correct.
haggard and let's
That
call the word
is
losyang
the
and all
goal.
that stuff.
Correct. To look refreshed.
Fresh. Happy.
Yan,
Happy about yourself.
and
Your
confident
mood.
about
Yeah.
yourself. Exactly.
Makes you
Yeah.
live longer if you feel happy
Right.
about yourself
Correct.
and not depressed or
Right.
just always happy. Joyful is the word.
Yeah. And the good thing right now is we have science.
Oh, yes.
Okay, to help us reverse the aging process. And we have treatments that are like derived from natural substances. For example, like a dermal filler, hyaluronic substance you find in your skin, in your system.
It's
And
already there. It's
exactly.
just giving it a boost.
Correct. And we have some peptide molecules that will help also the wrinkles. Actually, botulinum toxin is amino acid peptides. Okay, so we have amino acid peptides in our system. So it will also relax muscles, get rid of the wrinkles. And we have an energy-based device called Ulthera. And so this is non-surgical facelifting.
Non-invasive.
Non-invasive, very safe. And I love Ulthera because it has visualization. We can see the tissues inside. We can safely deliver the energy pulses from Ulthera to avoid any adverse effects.
I'm ready.
There you go. There is safety, okay? A natural result, okay? And I could say minimal to no downtime actually, okay? Because the Ulthera doesn't have needles and we can do it anytime. It can be a lunchtime treatment. And busy si Ma'am Pinky. Kailangan walang downtime na mga procedures. So we're all excited. We'll show the procedure when we return. And we're back. So we're here with Ma'am Pinky. Okay. So we'll start with the Ulthera, and our Ulthera will help in restoring the lifted face tissues here. We want to treat the jowling here and some of the mid-face sagginess here. And we'll also work on the upper eyelid because we notice already drooping upper eyelids. Okay. So we'll work both on this left side and the right side. And I noticed that one side is droopier, okay? So, yeah, because there's like an inherent asymmetry, okay? Even the eyebrows, the position may not be perfectly equal on both sides. Like when you're doing your eyebrow makeup, right? You notice one side is lower, the other side is like a bit higher, something like that. Or like when you're doing your expressions, the so-called quizzical eye, there you go. So one can be higher than the other. And then you'll notice on the upper third, there is a muscle that can be stronger than the other. Okay, so I'll have this pain freeze. This will also help in numbing the skin. A while ago, we applied topical anesthesia. We left it for like half an hour, okay? Then I'll also spray. I'll start with the jowl area here. We'll work on the tissues that went down here. So this is just a spray, okay? Something cold. Yeah. And that will help in reducing any sensation of the energy pulses from our ultrasound devices. So I'm starting on the jowl area, and the good thing we have a visualization, and I can see I'm on this mask layer. We want to target that, and this is gonna be the first shot, okay? How is it? We're good. Okay, so I'm just gonna continue with that. So working on the inferior jowl, then I'll just move this device going upwards to the mid-face section. So our goal is to target the layer, the so-called muscle aponeurotic layer, because that layer, we want it to contract from inside to create that lifting, okay? So how's the sensation, Ma'am Pinky?
Nothing.
Nothing. Good. Awesome.
There is,
but it's fine, yeah. It's just like some tiny pricks inside, okay? So we can work on the tissue layers, like we call it the SMAS layer in our anatomy. That is the layer 3. Layer 3, yeah. Then what we can do is also combine with the cold compress on the other side, like on and off there. Okay, there you go. So we can deliver, for example, on this side 40 shots. Okay, we'll just continue with the 4.5 millimeter depth.
Wow,
yeah. So on the 4.5 millimeter depth, again, it passes through those layers we call the skin layer, epidermis, dermis, subdermis, or your subcutaneous fat. Then it goes to this mass layer. The SMAS layer is between the superficial fat pad and the muscle, facial muscles, okay? So there's a sensation, pricking sensation, a certain temperature also. We have to emit that temperature, okay? Okay. Just gonna squeeze the tissues there. So our goal is to reach the SMAS layer together with the superficial fat pads, and we want to tighten this, okay? Yeah. Yes, that's cold. So we're just gonna do it up to the 40 shots. Then after that, we'll use the 1.5 millimeter. Okay, 4 shots more. 1, 2, 3, and 4. So to lift this area. Okay. Let's now proceed to the 1.5 millimeter depth. Okay, so again, our Ulthera has 3 transducers. We have the 1.5, 3.0, plus the 4.5 millimeter. So it's targeting multi-layers, different layers of our face tissues. Because aging is not only on the skin envelope, it's also inside. So even the subdermis, the muscle layers, the bone layer, it will also undergo like an aging process. So I want to work on the tissues here on the upper eyelid, and we want the upper eyelid to have this tightening effect. Okay, so this is cold again. So we'll use a narrow one. We'll decrease the length of this one, so we can make it 15 millimeter narrower. Okay, just to target the upper eyelid tissues there. Okay, and 0.8 in energy. Okay, so we apply a gel here. We'll work on this one. So we'll give it like 10 shots here. So first shot. How's that? Just fine, right? Okay. So we'll just deliver 10 shots here. Okay. Just to do a lifting of the upper eyelid. Because you know, over time, whether we like it or not, the descent of the facial tissues, not only the pull of gravity, but some of the ligaments become weaker. So we need 2 more shots, and then we're gonna go to the left side. Okay, 1. There you go. How was that? Tolerable. It's kinda
Tolerable.
yes. They say right now.
Kinagat ka lang ng small langgam.
Right. It's normal that this treatment, there's a sensation of some discomfort. That's part of it, you know. But if you don't feel anything, then it could not be effective, you know. So you want something with an effect. So I'm just gonna close the eye area there and spray this pain freezer. Okay. So cryogen pain relieving spray. Okay, I'm just gonna direct it in here. Place it 15 millimeter. So make it 15 millimeter to narrow the length of our delivery of shots. Okay, there you go, 15. Okay, so 10 more shots here. So again, the goal is for upper eyelid lifting or eyebrow lifting as well. Okay, so we want to target, actually you want to go or target the fibroblast cell tissue layer here. The fibroblast cells are the ones that will produce new collagen in our skin, okay? We just want to wake them up, okay? Stimulate them and awaken them. Yeah. Fibroblast cells, wake up. We need you to work. So they're found in the second layer of the skin, the so-called dermis area. Okay. So we'll finish with the half side of the face. I also want to improve the nasolabial line and the marionette line here. Now for that one, I'll be using hyaluronic filler. We have specifically the Belotero Balance. Now the Belotero Balance have this good tissue integration. Okay, they kind of blend well, integrate well with our soft tissues. So since we have the visible marionette line here, okay, there you go, the puppet line. So we want to like lift the dent, okay? It's also called like a static line already, because even without facial expressions, you see already those,
because of the gravity.
Right, full of the gravity.
So, filler, if we filler.
Exactly.
Parang sa kalye,
yeah.
cementuhin.
Cementuhin. There you go. So disinfect the area plus paint freeze, please. I'll start with correcting the nasolabial. Paint freeze, please.
Paint freeze, please.
There you go. And then I'll make an entry point of, okay. There you go. So this one, I'm using a gauge 21 to make a tiny puncture point here for my entry. Okay, just a tiny freaking helix here. Okay, there you go. And then I have a gauge 25 cannula, and I'm just gonna deliver it. Actually, my plane of insertion will be in our subcutaneous plane. Okay, so there's a 2 layer that you want to work on here. It is either the layer the layer 2 or the layer 4. Okay, so we're looking at the entry point right now. So Mom Pinky has a very good skin, so another prick here. Okay, and then I'm just gonna need to look at that entry point. There you go. Okay, so I'm using a soft cannula and just glide it in the layer 2 of our face tissue. So we have some tissue layers, okay, for our doctors. You remember layer 1 is your skin, layer 2 is the superficial fat layer, and layer 3 is a mass layer, and then layer 4 is what we call like the true retaining ligament with the space, and layer 5 will be the periosteal layer. So I'm just gonna be injecting gradually, so it's gonna be like a linear retrograde technique. There you go. And then I'm gonna go back again to just fill in and really improve the nasolabial line here. Okay, so we just want this to be not so deep, we want it shallow. Okay, there you go. So I have to go near the so-called inner groove. Okay. And we're almost done with the half of the syringe. Okay, so I'm done with the upper right nasolabial. Okay, let's do the marionette fold here. Paint freeze, please, on this part here. Yeah, we can sing while doing the treatment. I do understand, yeah. Some pressure that you feel when you do this. I'm just gonna make a tiny entry point here. This is to correct the marionette line, or we call it the labiomandibular fold. Okay, I'm just gonna glide it again in the layer 2. Okay, so we want to go at the subcutaneous or the subdermal layer. Okay, turn to the left side, please. Thank you. So I can direct it to the corner of the mouth. So you'll notice if you have a deep labiomandibular fold, there's downturning of the corner of the mouth. So we need to restore some support there, okay? Just gonna glide it into this area here. So give support to the oral commissure on the right side, okay? So I'm just pushing. So I'll do a semi-fanning technique, something. Parang exercise prior to the concert. And preparing the voice. Sabi, bawal daw ang malamig na tubig.
Mm.
No cold water.
I drink cold with ice.
Oh!
I contest that.
Ah, okay. Now, you've heard it from...
Only shouting,
Okay.
using your throat, and only hamog will
Okay,
destroy your voice.
Oh.
But I drink ice cold.
Ice cold.
Before and
Okay.
after a show.
Oh, now, okay. So, that is... What do you call that? We debunk the myth that you cannot drink cold water before singing and after singing.
Yes, I
Okay.
do drink cold. It's must.
It's a must. Okay, now we know. We've learned. I thought they cannot drink cold. Yan.
I personally drink ice water.
There you go.
What happened?
So, we're done with this.
What?
Let's do the upper
What?
third botulinum toxin, okay? So the product I'm using is the zeomine, okay? And this is a pure product because it doesn't have complexing proteins. I'll start working on the crow feet on the right side, okay? Spray
Spray this.
before we inject. So I'll use the 3 injection points. Okay, I'll stretch the skin and inject intradermally and push 2 units there. And another, like a 1 unit on the upper and a 1 unit in the inferior. Okay, there you go. Now we can go to the glabella part. Glabella part.
That's where my frown is when I
Yes.
express on the drama, TV, singing.
There you go.
No,
So the
that's
goal
tough.
is more for relaxation of the muscle, not really paralyzing it. So I'll work on the procerus. Procerus.
So you have to have
parang-
expression pa.
Yes. So I'll work on the left corrugator here. Okay, intramuscular, okay. And then on the right corrugator there, intramuscular. Okay, there you go. And we need to reach the tail. Okay, pain freeze, please. Okay, and the tail here. Okay, there's a tail, there's a head, and then on the other side, yeah, there you go. Yeah, I'll pinch this area here and inject. Then we'll go to the frontalis muscle. So we have the center frontalis and then the right frontalis there. Okay, we're almost finished on the right side. Okay, there you go. Then let's do the left frontalis. Okay, almost done with the Botox. I know. Multiple injections here. Then let's do the profit left side. There you go.
Profit.
There.
More here.
More here, yeah. Then almost done with the Botox. Okay, there you go. So let's finish the left side of the face. Okay, we've done the Ulcera. We have also done nasolabial filler, marionette filler, plus upper third.
I'm still alive.
Yes, the upper third Botox for Ma'am Pinky.
I'm happy.
Yep.
No pain, baby.
Alright, and we'll show the results when CSA Medical Aesthetics returns. And we're back. Let's show the result to Ma'am Pinky. Ma'am Pinky, we have our mirror here. You can check the outcome of what we've done. The combination.
30 years younger.
Yes.
Guys,
The
believe me.
combination Ulcera, Zeomine plus the Belotero balance.
No, the line
right?
here is gone.
The puppet line.
Just
instantly.
now, syempre I
the
still
right
feel
side.
puffy and stuffy than
Right.
with the
It was just
sensation.
Exactly.
This one was deeper, much,
Right.
but soon it will be flat.
Yes, it's
Ooh.
less deeper, it's shallower, but over time it will still improve because the hyaluronic substance attracts water. There will still be kind of like a tissue expansion there and stretching of the skin there. You just need to drink a lot of water because our hyaluronic
green
substance
tea?
is
Green tea.
pure water. Okay, green tea is fine. Okay, green tea is fine. Now it's a hydrophilic substance. It attracts more water. Okay?
Water, please.
Yes, we'll drink water, okay? So for now, since we've done the Ulcera, we give it like a 12-week time to see more of the
Water
effect.
lang daw.
Yes. Collagenesis happens from the 4th week to the 8th week to the 12th week. And you'll see more and more improvement as new collagen is synthesized from the skin dermis. And the injection of our botulinum toxin on the upper third of the face, we see the results after 2 weeks. So usually the maximum effect will be seen in 14 to 15 days time. But some of my patients, day 3, they already notice improvement on the lines on the forehead and the glabella. But this is more of a relaxation. We still want you to have a very good facial expression. It's not making you looking, frozen.
Sad,
there you go.
sad, happy, shocked.
Right. So we can still see some of your emotions on your face. There you go.
Especially when you do the drama scenes.
Exactly.
Oh,
Thank
it's
you
balanced
so
now.
much.
My
Right.
eyebrows are going up together. Look.
Right. Because
Are
we
they
did
going
the
up together?
Ultera. We did the Ultera also on the upper
It's
eyelid.
going up together.
So there you go. We have appreciated some instant result here. Okay?
Yeah.
Especially with the Belotero balance on the nasolabial and the marionette line there. And of course, over time, it will still rejuvenate your face, your
Yes.
skin tissues. There's gonna be more regeneration happening. Okay.
Exciting
Yeah.
to see the result, but I'm
Exactly.
happy. My feeling is I'm happy. I'm here, and we're doing something for the future. A few days, I'll see the results. But I'll be back in 2 weeks,
Yeah,
right?
we still have a follow-up to,
More results.
check the outcome, how are the muscles working. There
Yes.
you go. And do a balancing of
Yes.
if there's still some asymmetry there. Okay, thank you so much, Ma'am Pinky.
Thank you so much. How do I feel? I feel happy if you're gonna go through this. It's so quick. She's so good and gentle.
Oh, thank
and
you.
also, you still have feeling of a tingling but very
Yes.
positive sensation.
Right, yeah.
Hindi siya like when you give birth.
Yeah. Oh my goodness. That's the most painful experience.
Yes.
Okay.
Especially when there's no anesthesia.
Oh no.
Okay,
Yeah.
I'm
So
happy. Thank you, Doc.
Thank you so much. Thank you so much for trusting us as well.
Of course.
Okay? Yeah. So we'll see more of Ma'am Pinky. This is just the beginning, okay? We have like a maintenance treatment for her.
Day
okay?
1.
Right. We'll show the results, like, we'll share pictures with them, like after 2 weeks, what happened.
Follow
okay?
me, press the
Yes.
subscribe button.
Right.
Follow to
Yeah.
see the before and after.
Correct.
Okay,
Yeah.
di ba yung mga iba may weight loss?
Right.
Oh.
And then,
Weight loss din, follow me.
yes, there you go. So,
Nag-lose
part
na
of
ako
the-
from 7 years ago.
Yes.
Wait.
Yeah, lifestyle management also. So it's not only like we base it on science or medical treatments of our
No.
doctors, but you yourself too. You have to
Be
help
happy.
yourself. Yes, be happy. Don't be stressed that
Joyful,
much.
no
be
stress.
joyful. Correct.
If there's a problem, throw it away.
Yeah, and also pray to God.
Pray to God always.
There you go. Thank you so much, Ma'am Pinky.
Thank you.
Yeah. Is there like any show?
We have shows usually at Kuyas at QC. Kuyas at QC is near ABS-CBN. 147 Mother Ignacia. We sing nice songs there, 2 sets. And we also go Bar 9. So just follow me on
Let's
Facebook.
watch Ma'am
Pinky
Pinky.
Marquez Can Show.
Right. We'll follow you. Thank
For
you
all
so
my shows.
much.
Thank
And follow
you.
us also at CSA Skin Clinic at yahoo.com. That's our email address. If you have any questions, just, send us your email, send us your questions. Even at our FB page, CSA Medical Aesthetics. Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragol, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. Ma'am Pinky, thank you so
Bilis
much.
mo na magsalita, Doc.
Opo, para lang reminder.
Angeles, Pampanga.
Yan. Amen. Angeles, Pampanga.
At the shops,
Yan. The shops Infinity. There
you'll
you
find
go.
it after Marquee Mall. Turn there.
Right.
Kasi
Very
ako,
good directions.
nahanap ko na.
Okay.
Ground
So, yeah.
floor.
Yes.
Ang ganda ng clinic, grabe.
Thank you
Interior
so much.
design and all.
And please
Super.
watch her previous episode that was
7
in our
years
old
ago.
clinic. You can check on Ma'am Pinky. She kind of stayed the same, okay? She didn't kind of age, okay?
7
Yeah.
years aged.
Okay,
Imagine
thank
that.
you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.